Hey everyone, Ben with Green Feet Medical. Today, Doc Woods is going to go over shoulder dislocations.
So the majority of shoulder dislocations happen as an anterior dislocation where the arm is outstretched and somebody lands on it. Typically what you'll see is the arm will actually be rotated in a little bit and sticking out. One of the things that you can always do is if there's a question, if it's dislocated or if they have a fracture, you can actually have them take their shirt off, or you can just look at the shoulders to see if there's a difference in the shoulders. And if you see that one side is rolled in, that gives good evidence to say that this is likely a shoulder dislocation. The other thing you can do is you can have the person reach across and touch their other shoulder. People that have a dislocated shoulder will not be able to do this just because it'll cause them too much pain. One of the things that I do that I think is the easiest way to get the shoulder back in is I'll go ahead and use downward traction and external rotation. And as you bring the arm in, it'll actually go right back in place where you'll actually feel a click and the person instantly will have relief of their pain. Some of the other ways you'll see, if you look on YouTube, different videos, you'll see lots of times people have other techniques. One is you can actually have a weight where you'll extend the arm out, have them laid down, and basically you'll wait for the arm to fatigue, and after that the shoulder will go back in place. Or the other way, you'll see people, you can tie a bed sheet to the arm and then have somebody pull on the arm and it can go back in place. However, the longer you wait, the more difficult it is going to be to have the shoulder go back in place because the muscles around it are going to start tightening up and are going to prevent it where you're going to be fighting against those muscles. Now, getting a shoulder back in place is something that anybody can do that feels comfortable. It is something that once you get the shoulder back in place, the person should still go to the emergency room, be evaluated to make sure that there's no other damage to any other structures that have happened. Again, just how to go ahead and get the shoulder back in place. I found that it's easiest if you grab the wrist, pull your arm close to the elbow, and you push down and maintain traction on the arm. As you do that, you'll go ahead and slowly rotate externally until you feel a click as the shoulder goes back into place.